I am here today to talk about Zika virus with Dr. Siobhan Dolan. Thank you for joining me.
Thanks for having me.
You know, there's a tremendous number of cases of Zika virus infection right now outside the United States. There have been 1.5 million cases in Brazil alone in the last year, and it's obviously caused a lot of concern around the Olympics this summer. We had some very high-profile examples of folks that were not going to participate or not going to be able to travel down there. 52 countries have reported cases of locally acquired mosquito-associated Zika virus as of just last month. So that's 52 countries around the world where mosquitoes are already transmitting the virus. And to date, there's been no recorded Zika transmission in the United States. Is that correct? Mm-hmm. There have been people who have acquired Zika virus by traveling overseas.
Right.
And where are they traveling? What are some of the countries where this is present?
Yeah, right now a little over 600 cases in the United States that were travel acquired. And actually, no. It's 600 cases in the United States that were travel acquired, and then over 1,300 cases in the U.S. territories. And so the U.S. territories includes Puerto Rico, the U.S. Virgin Islands, and American Samoa. And that's important to remember because those areas are in areas where the virus is actually circulating amongst the mosquito population.
Puerto Rico has been very hard hit already.
So we want to keep sort of those two sets of issues separately. If you're, as an example, where we are here in New York, then really the concern is about travel-related exposure. And really the concern is about pregnancy-related exposures because although Zika virus does pose some threat to regular people in terms of having, a short illness that's associated with fever. There's a conjunctivitis or a red eye that's associated. You can have joint pain. You can have muscle aches and so forth. Headaches as well, for sure. It's rather self-limited, and so it doesn't pose a dramatic risk. The real issue, as everyone knows, is that when women are exposed during pregnancy, especially early in pregnancy, the risk of the fetus being infected and having microcephaly, which is lack of development of the brain, that's really what poses the greatest risk. So that's really, I think we should reinforce who and where we're talking about. For folks in the United States thinking about travel, especially if pregnancy is part of your short-term or long-term plan, that's something to really stop and think about and contemplate. Get good advice from your doctor, learn lots of up-to-date information, and then think through what's the best plan for yourself.
And I think it's a good point to make that obviously our advice here today doesn't replace what you should be getting from your doctor. So use common sense and talk to your doctor. Now, they do know now that Zika virus can be transmitted sexually.
Yes.
In the beginning of the reports about this virus, they thought it was just pregnant women might get stung by a mosquito. The virus would be transmitted to the pregnant woman's blood by the mosquito. But they now know that the virus can be stored in semen and also in saliva. Is that right?
Yeah. So the saliva, yes, it has been detected, but there haven't been cases reported to my knowledge through kissing, quote unquote. But there have been reported cases, and the cases have been reported of actually transmission from a man to a woman. And so the real recommendation there is to use condoms for sex of any variety where there could be transmission of fluid from a male partner, and that's what we want to really recommend. Now, if you're pregnant or planning to become pregnant and your partner has traveled to an affected area, there is, the best recommendation, which is the most cautious recommendation, is to use condoms. So that is really an important message to get out there.
So if my partner traveled to a place where there was Zika virus, after he came back, we would want to use a condom for how long?
So the recommendations for the partner, the most conservative estimate is 6 months, and that's because they found Zika virus in semen up to 62 days. Now, if your partner, your male partner, was infected, either had symptoms or had a test that showed Zika virus infection, the recommendation then is clearly 6 months.
Right.
If the partner was not affected but just traveled, the recommendation is 8 weeks, but the most cautious recommendation is out around 6 months.
And I think the reason they're being so cautious is that It looks like maybe only about 1 in 5 people who are infected with Zika will actually show those symptoms that Dr. Dolan mentioned. So like the headache and the muscle aches and all of that, only 1 in 5 people actually have the symptom. So, there could be a risk even if your partner's not symptomatic. So, and I know Dana with us here today is moderating, and she has a question from the audience. So Dana, tell us what you guys want to know.
Yeah, we have a few questions rolling in. Right now, Catherine Marcano-Bell is worried about her risks with Zika if she's doing IVF. So if she's already had her eggs frozen, is the virus in the body going to affect the embryo?
So there's question, but who was traveling where, or where does the Zika exposure concern come from? Do you know what I'm trying to say? Because if she's in the United States, if she has a remote travel history, like she was in Puerto Rico over Christmas, let's say. I practice in the Bronx. We see a lot of women who traveled over the holiday season, very understandably, and it was actually right before the public awareness had really grown. So we're seeing a lot of women thinking back. Now, if it was, let's say it's that scenario, the past exposure is not going to pose a risk of Zika virus infection if this woman is undergoing IVF today or next week and so forth. So no, your risk doesn't stay with you. It's at the time of the actual intercourse, or in the case of IVF, right, there is exchange of body fluid. It's smaller, right, it's an egg and a sperm, but that could, at least theoretically, be associated with transmission. I'm not aware of any reports associated, so I don't think it poses a great risk. And I also would suggest that this individual talk to her IVF center and really flesh it out and look at her personal circumstances to make sure she understands.
But if someone had IVF and then traveled while in the first trimester, you would be at the same level of risk as anyone else who's pregnant and traveling in the first trimester, which is the time of most concern. So if you're going to have a cycle of IVF, don't then plan a trip to an area where Zika virus is known and reported especially during that sensitive first trimester. And I'll just stop here for those who just joined us. I'm Dana Points. I'm the editor of Parents. I'm here with Dr. Siobhan Dolan from the March of Dimes, and we are talking about Zika virus and trying to answer some of your questions and address your concerns. So my associate, my doppelganger, the other Dana over there, has a question for us.
Yeah, this question is coming from Kendra Murphy Perk, and she wants to know, would it be best to delay a pregnancy until after the threat of Zika is over?
Yeah, so I mean, there's different answers to that. Certainly there's been some public notoriety of countries and governments that have said, yes, consider doing that. And that, I think, again, comes out of a place of caution and a lot of uncertainty. I'd say for an individual woman, if let's say in the next year you're thinking about pregnancy and you're planning a big trip to the Caribbean, let's say this is just your personal goals, I'd do the trip first and use contraception and then do the pregnancy down the road. So like absolutely, to the extent that you can be very crystal clear to not put the travel and the pregnancy in the same equation. Dana and I are talking about this, but it's not just our opinion. CDC guidelines are very clear to avoid travel to these areas if you're pregnant or anticipating or planning pregnancy. WHO as well. So, I think these organizations are acting, again, out of caution, but really wanting to protect women and wanting to minimize risk. And, when you see a woman who's been, and I think some of our audience may be in this position, sitting with the anxiety. I went on that trip and I'm pregnant and I don't know the impact and the testing is a little unclear and the ultrasounds are okay so far, but I'm really not sure. That's a lot of anxiety to carry around for 16, 18, 20 weeks for the second half of your pregnancy. So we really want to help women, minimize that by just trying to not put themselves at risk if they can.
Yep. I mean, one of the interesting things is that if you're pregnant, you've probably noticed this, your mosquitoes like you more, right? So nobody completely knows what the reason for this is. It might have to do with respiration and how much carbon dioxide you exhale. There's lots of different factors that make you attractive to mosquitoes, like how much you sweat and what kind of minerals and substances are in your sweat and what kind of bacteria live on your skin. But they do say that pregnant women are like 20% more likely to get bit. So why put yourself in that position? And Dana has another question.
Yeah, this question's from Allison Moore. She's in Southern California. She's 5 months pregnant. She doesn't plan to travel, and neither does her husband, but should she be taking preventative measures, like using bug spray, or using condoms, or does she have no risk because she is in Southern California?
Yes, so there's no such thing as no risk, unfortunately, but
with anything, really.
Right. But I also wouldn't suggest that Allison's at great risk, right? So she should follow standard precautions. I wouldn't say she's in a risk category where condoms are recommended if neither her partner or herself have traveled to an affected area and they're in Southern California and planning to stay there. I don't think that's required per guidelines. The mosquito issue, absolutely. The guidelines are clear. We don't know the exact transmission patterns of the mosquitoes. We're going to, the CDC and folks are watching closely, especially in the southern part of the United States, but that's going to be an unfolding story. So absolutely, mosquito protection in terms of the repellents, covering your skin if you're going outside, staying in air-conditioned places, using bed netting if you're in a place, especially now if you're traveling to an area, you really want to ramp up those mosquito protection.
And there's pretty good evidence, as you probably know, the most effective mosquito repellent right now that's known is DEET. Don't ask me to say what that stands for. It's a complicated chemical name. But there's pretty good evidence. There's not been a lot of research on pregnant women and exposure to DEET, but there were some studies, and it looks like you can go up to about 20% DEET if you are pregnant. So look on the label. It's always there in the superfine print what percentage DEET the product has. You want to avoid lemon eucalyptus, is it, if you're pregnant? So there are other mosquito repellents, and one common ingredient is lemon eucalyptus, so you want to avoid that one if you're pregnant.
Yeah, and also with any of the repellents, you want to use them according to guidelines. So yes, use them, but don't overuse them. And then another piece of that with repellents is that you want to put your clothing on first, and then you want to put the repellent on the exposed skin areas. You don't want to put your whole body with repellent, because then you'll have much more absorption in areas that aren't actually going to do you any good.
Right.
Another issue, this is kind of an interesting one, is sunscreen and insect repellent, right? Because it's like, how do you go out of the house? Because there's so many guidelines these days. You want to put your sunscreen on first, again, in the exposed areas. And it sort of makes sense to me, right? Because you're wanting to protect your skin. And then you want to put your bug spray or insect repellent over your sunscreen, because that you want exposed to where the bugs would be coming in. Does that make sense?
Yep.
So this is sort of, just a little guidance in the back of your mind. If you can wear long sleeves, then you can, again, limit exposure of what you're actually putting on your skin, but use the repellents and just use them according to guidelines. And as Dana said, up to 20% with the D is safe during pregnancy.
And depending on where you live, there are different kinds of mosquitoes. So there's the Aedes aegypti, which is the one right now that they're seeing is transmitting the Zika virus in big numbers. There's also, like right here where I live, we have the Asian tiger mosquito, which is also thought to perhaps may eventually play a role in Zika transmission. So you kind of have to look a little locally to see what's going on. But if you're sleeping, you can use the bed netting like you recommended, but also keep a fan blowing in the room, because if you're blowing air down on yourself and the mosquitoes, they can't get to you as easily. So that would be another precaution. And obviously put screens on your windows, get rid of standing water around your home, report anybody, neighbors and such, who has standing water who refuses to take care of it. And Dana has another question for us.
Yeah, this is an interesting one. It's a question from Tara Hall Peterson. So she's breastfeeding, and she's not sure if there's a concern with that. She's not traveling, but she just wants to know if she should, consider that.
Yeah, great to consider it, but we can be very reassuring around breastfeeding. So for breastfeeding, even if you've been exposed, even if you've been infected, it's safe to breastfeed. If you think about it, in order for the viral infection to have any impact on the baby, it has to go through a lot of different steps. And so there haven't been reported cases of transmission via breastfeeding. And the benefits of breastfeeding are so tremendous that at this point she can really feel reassured to keep breastfeeding.
Great. Anything else while we're with you, Dana?
Yep. So we have a question in from Jill Lee Van Compernol, and she wants to know she's pregnant, and she wants to know, do pregnant women have anything to worry about if we live in the U.S. and have not traveled?
Yeah, so today, June of 2016, the answer is no. There have been no reported cases in the United States. If her male partner has traveled, again, I wouldn't worry, but I would use condoms because that's a recommendation. The story will evolve over the summer. We don't want to be overly concerning, but we have to be honest about what we know and what we don't know. And I think when I say we, the whole public health community and the obstetrical community are going to be watching. There is concern that the southern part of the United States will be affected, and there will be mosquito-borne transmission within the United States. So I think we have to, any pregnant patient should keep abreast of what's going on, keep in touch with her doctor, and there's some good websites, cdc.gov/Zika, marchofdimes.org/Zika, and nacersano.org/Zika in Spanish, and then I'm sure Parents is keeping up
and
as
we'll
well.
Post all of those on the
Keep
video
up to date.
after our conversation today. They do think, based on the reports that I've read, that where it will pop up in the United States will probably be Florida or the Gulf Coast.
Mm-hmm.
Those are the parts of the country that have the conditions and the type of mosquito that is most conducive to this. The other thing I think is interesting about if you do travel outside the United States that was really surprising to me, because I never thought of this until I read about it a little bit, is if you come back from a country where Zika is endemic, let's say you travel to Brazil for work purposes and you come back to the United States, you should use mosquito repellent to keep the mosquitoes here in this country from biting you, because one way they think that transmission might start in the United States is that a mosquito in the US will bite an infected person who maybe doesn't even know they're infected, who's come from Brazil or Puerto Rico or another country where there is Zika. So we all sort of have a public health job to do if you travel outside the United States to a country that has Zika. And I think Dana has another question for us.
Yep, we do. So this is another good one from Maria Celestino Nos. She wants to know, is there a point in pregnancy where we don't need to worry about Zika? Trimester versus trimester, and how it affects the fetus.
Yeah, it's a great question. So for the moment, we don't have all the data, but it is looking like the concern is greatest for the risk of Zika virus infection actually causing and contributing to microcephaly in the first trimester. And if you think of a pregnancy that we think of as about 40 weeks, the trimesters are the first 13 weeks, and then 13 to 26 to 28, and then 28 weeks to 40 weeks, which is when your due date is. So the first trimester, in that, the data so far looking at French Polynesia and Brazil is that about up to 13%, it may be lower, but up to 13% of women who are infected with Zika virus during the first trimester of pregnancy will go on to have a baby with microcephaly. So the first trimester is the area of the greatest concern. It's a tricky time because a lot of women might not be sure quite yet that they're pregnant, so we would definitely encourage attention to pregnancy desires and being really clear about travel and pregnancy in the first trimester, because that's the time of greatest risk. So think about that. Second and third trimester, the data suggests are not at as great a risk, but I don't think it's absolutely a firm conclusion yet. But the focus on first trimester is clear. And actually that's consistent with any teratogen, any exposure during pregnancy. The first trimester is when the organs are forming, when that brain, that precious brain and all that neurologic tissue is growing, and it's just a really susceptible time. So it isn't totally surprising that that's the greatest impact, but certainly really important for women to think about as they think about pregnancy.
And just to be clear, 50%, I think it is, of pregnancies in the United States are not planned. So, if you are traveling somewhere where there is Zika virus, and you're not having protected sex, you're not using good birth control, and there's a chance that you might become pregnant, it's important to think about that possibility and to take precautions or not travel in the first place.
For sure.
So Dana has another question for us.
Yeah, so what if you actually have a newborn and you want to go on a vacation? Melanie Field wants to know, what if a Zika mosquito bites my 6-month-old?
Yeah, that's a good question. So it doesn't appear, first of all, a 6-month-old is not going to then have microcephaly, right? Microcephaly is a birth defect. It's from in utero exposure, and it has to do with the brain development. So a newborn up to 6-month-old who's doing well, healthy development, is not at risk for microcephaly. The exact exposure, again, I don't know that we know there's zero risk, but there certainly haven't been reported dramatic effects on children throughout. You know, the Zika virus has been around since the mid-1950s or so, like in Uganda in Africa is where it first started, and it's made its way around through Asia. And it hasn't had a huge impact on either adult health or child health. The pregnancy-related issue, they think, has to do with the fact that it moves so quickly from Polynesia over to South America, and so the population of women had no innate immunity because it hadn't been exposed, and so it really had a dramatic effect on pregnancy in this group of women in South and Central America who had never been exposed to the virus as teenagers or as young children, if that makes sense. So,
which is the same in the United States,
yes,
right? Like the women in the United States, U.S. has never had Zika virus either, to our knowledge. So we're this kind of fresh group of people as well. I will say though, the question about the baby, we haven't yet talked today about Guillain-Barré syndrome, which is this condition that causes paralysis. It's sort of an autoimmune response, and it's a very rare condition, and it's, you know, can get very bad, isn't always very bad, but just to be clear, it's very rare. However, there is now a pretty established connection between Zika and Guillain-Barré, and in countries where Zika has become endemic, the risk of Guillain-Barré has gone up. It's been a small risk to start, so it's still a small risk, but you know, we can't say with certainty that anyone who acquires Zika might not end up with Guillain-Barré syndrome.
Yeah, for sure. I think that's still a little bit of a question mark, but I definitely recommend that folks talk to their pediatrician. You know, travel it with a new.
And a 6-month-old, you can use bug spray, right? So after the child is 2 months of age, the American Academy of Pediatrics says it's okay to use an insect repellent, right? You know, follow all the guidelines, so you don't spray the stuff all over the child's face. You want to put it only on the exposed skin, as Dr. Dolan mentioned before. With a really little one, you don't want to put it on their hands because their hands go right in their mouth. And you can use a low concentration of DEET. So, you know, it means that you could travel somewhere and use a bug spray and use a mosquito net, and in a baby definitely use a mosquito net,
or in a stroller net
in a stroller, right, or a bed. Yeah, Dana, you have another question?
Yeah, we definitely have some more questions rolling in. This one comes from Alicia Heitman. She was in Cancun just over a month ago. She had 0 symptoms, and for both her and her husband, but the doctor wouldn't check them since he said that they have 0 symptoms. Should she fight for blood work just to be sure?
Is she pregnant?
She didn't say, but let's say if she was pregnant.
Okay, so if you're not pregnant, then the answer is no. Without symptoms and without pregnancy, there's no testing recommended. If she's pregnant, she could, she would qualify for testing. And you know, right now testing is happening through state departments of health for the most part and through CDC. So she should and could go back to her doctor and discuss it, but it really has to do with pregnancy.
She's 4.5 months pregnant.
4.5 months pregnant. Yeah, she should go back to her doctor and she should talk to them about testing. She can also touch base with the State Department of Health to find a location. You know, because this testing is rather centralized, hospitals are centralizing the testing as well to be able to offer to the appropriate women and then follow up the results. The testing's pretty complicated. There's blood and urine testing, and then there's windows of opportunity, and so if you recently traveled and recently had symptoms, we do one set of tests. If it's more remote, there's a different set of tests, and it's a rather complicated algorithm to interpret because it's a viral illness, so the early tests actually are testing for pieces of virus in your urine or your serum, but then the down the road tests are testing basically for your body's immune response to the virus as a way to kind of retrospectively think to ourselves, oh yes, she was exposed. So it's tricky, and it takes a lot of good minds in these labs and public health departments and these clinical sites to put it together and assess a woman's real, risk of exposure. The other thing that we're doing obstetrically is following women pretty closely with ultrasound and trying to really identify any situations with microcephaly early and offer women, close follow-up so they know the status.
And just to let those of you who are just joining us know, I'm Dana Points. I'm the editor of Parents. I'm here with Dr. Siobhan Dolan. She is with both the March of Dimes and the Division of Reproductive Genetics at Montefiore Medical Center here in New York. She's also the author of Healthy Mom, Healthy Baby, The Ultimate Pregnancy Guide. So when she's talking about testing for viruses, she knows a thing or two about this topic. Thank you so much for being with us, Dr.
This is great.
Dolan.
I love hearing from all the Parents Magazine contributors and the audience. It's wonderful to hear.
Yeah. Do we have any other questions right now?
We do. We have a kind of a general question from Rick Raymond. He wants to know this. Well, he says this virus has been around for over 50 years, and why is this now becoming an issue?
Yeah. Do you want to take it?
No, go ahead.
Okay. I think, you know, what they believe happened, right? If a virus just marches bit by bit across the globe, and that's actually what they believe it did, from Africa to the Middle East to South Asia. So, you know, if you're 5 years old and you're playing outside and you get bit by a mosquito and you get a Zika virus infection, you might have itchy eyes for a few days, or you might have no symptoms. But now your body has created an antibody response. So if the virus goes slowly, then you get an antibody response, and then when you're 25 years old and you get pregnant, or you are pregnant, and now you get bitten and your Zika virus is in your body knows how to fight it, and it doesn't pose a great risk to your pregnancy. But what happened is, and if you think of the Pacific Ocean, there was no like step-by-step progression, and they believe in the bigger picture that it maybe was some sports teams from areas in French Polynesia and other places in the Pacific where the virus just like, came amongst folks in a day or two with global, rapid travel to the Brazil area. So now the mosquitoes are biting women who have no immunity. So it's never been in South America. No child was bitten and now has an immune response. So if you're 25 years old and you're a pregnant woman and you get bitten, that virus goes straight into your bloodstream, and we know about the Zika virus. It's what they call neurotropic. It loves neurologic system. It loves neurons and brain cells. So it just gravitates right there, and the effect is devastating because the immune response hasn't been built up. So I know it's a long answer, and I think it's actually quite fascinating.
Makes sense to me.
Yeah.
I have to say. One of the things I've found so interesting about a lot of the reporting on this topic has been that people often say microcephaly. So a woman who is infected probably in the first trimester, in some cases, will give birth to a baby who has microcephaly, which keeps getting described in the reports I read as small head. But microcephaly actually has developmental consequences and brain damaging consequences.
Yeah.
Can you talk a little bit about that?
Yeah, for sure. And actually the basic science that's supporting what we've observed is that the virus attacks neurons and nerve cells and really just destroys them. So what we see, sadly, in a child that's born is that they have microcephaly, they have a small head, and it's because the brain isn't growing. Developmentally, the way your skull grows is your brain grows and pushes the bone to grow, and so there just isn't that. Those cells have been destroyed. So yes, then of course, once a baby's born with a much smaller brain with fewer cells, with many cells that have been destroyed, the growth potential, the developmental potential for that child is diminished.
Right, which is, I think, to answer that earlier question, another reason that we feel like we're hearing about it now is because the consequences are pretty devastating.
For sure. And to put it in context, up to 13% of women who've been infected will likely go on to have a baby with microcephaly. So that's a big number on the one hand,
yes.
But it's not everyone.
Right.
So we just want to temper the messages.
Right.
But the real message is do everything you can for prevention, because certainly, when we see the stories and when we see the babies, if you can, as a family, get to a point where you don't have to face one of those challenges, we would just love to be able to help provide information to help you with prevention.
Right. And there's going to be lots of great links included afterward on our post so that you'll be able to keep up with this issue going forward. And Dana, I think you said you have another question?
Yeah, we do have more questions. Christian Cara Silva is going on a trip to Puerto Vallarta, and she is 25 weeks pregnant. Should she cancel her trip?
She should cancel her trip. Yeah, I'm sorry. And it's not my opinion. It's just clear, and every organization, CDC, WHO, I think her doctor would agree, the risk outweighs the
airline would
benefit.
probably agree too.
Yeah.
Many airlines are, depending on when you booked your ticket, and travel suppliers are refunding money if you can document that you're pregnant and that you bought your ticket before X point in time. So,
I know, so just think of it as like rescheduling the trip
Yes.
for a year from now, right? We don't want to squash people's fun, but it
Right.
is clear that it's not an exposure worth introducing into the pregnancy at this time.
right. Any other questions?
Yeah, we do. We have one more question. We have another question from Mishi Yu, and she wants to know, shifting over to now, if you have a child, the impact may not be as great, but what if a child is bitten by a mosquito with the Zika virus? Just what are the symptoms, what are the effects, and how would you know if your child is bitten?
Well, only about 20% of people who are bitten will ever show the symptoms, for starters, so your child might not exhibit any symptoms. But the common ones are headache, right? A sort of pink eye-like conjunctivitis, other aches and pains. They describe it almost as like a flu-ish feeling, if you think about what the flu feels like. Although fever?
Yeah, fever.
Too. So
Yeah.
it really does, I mean, as a mom, I can say that it sounds like just about every childhood illness, wrapped into one.
I think one of the most distinguishing characteristics is the conjunctivitis, the eyes with discharge and redness.
stuff.
Yeah,
Yeah.
because like Dana's saying, every viral illness is going to give you fever, joint aches, muscle pain, headache. But if you have eyes affected, that's something to think about. But again, if you have a 6-month-old or a 1-year-old, you're going to go to the doctor, that's fine, you should take your doctor in and be checked out, but it is just supportive care. You want to bring down the fever with medication. You want to make sure the child still stays well hydrated. There isn't, an absolute treatment targeted at Zika, and you can't blame yourself. There's nothing you can do to prevent it. We hope to have a vaccine down the road, but it's several years down the road at this time.
Right. Yeah, and another question.
Yeah, we do. What is the March of Dimes doing to help prevent the Zika virus from spreading?
Yeah, well, we're doing a lot of things. One is spreading public health messages, so we're delighted and we thank you for the invitation to do this. The other piece is actually really trying to lead the charge for about 80 organizations that are really working and lobbying Congress to pass the emergency funding for Zika prevention efforts, because really now is the time, and there's been a lot written about that. Now is the time for mosquito eradication. Now is the time for educating women. Now is the time for letting women know to postpone travel. So this emergency funding is really an important step, and so we invite everybody to advocate and really try to get money dedicated to this cause so we can all be healthy.
Great. I will say I rode the subway to work this morning, and on my train there were lots of ads about Zika and telling you to use insect repellent and get rid of standing water around your home, and I was impressed by that because it's not here in New York yet. So Dana, another question.
Yeah, actually we are getting a few questions in from different users about that lemon eucalyptus oil, so can we just revisit that and just
I'm gonna
let everyone know what the clear,
Yeah, so what I'll do, because there's no magic here, cdc.gov/features/stop mosquitoes, okay? So the oil of lemon eucalyptus is in the agent called Repel. It is an active ingredient that is recommended. But
just to be clear, there are other Repel products that contain DEET. So it's not all Repel. In fact, there's I think a Repel family that in a recent Consumer Reports test tested really well, repelling mosquitoes. But so not all Repel products, just some.
But the recommendation is do not use products containing oil of lemon eucalyptus or paramethanediol, PMD, on children under 3 years of age. So that's the clear-cut guideline for CDC.
Right, and so I think with during pregnancy, also no lemon eucalyptus. I think because it's something that's not recommended for a child under 3 probably isn't going to be recommended for a person who's pregnant either. Is that the thinking?
Yeah, I haven't actually read it that, so I don't know the answer.
Yeah,
but
check the CDC website for sure.
But the active ingredients that are recommended are DEET, picaridin, the oil of lemon eucalyptus, and then there's a few others. So, definitely take a look at what product you're looking at using, what the active ingredient is, and then if it's pregnancy related or child related, and sort of put all those pieces together, make sure you're making a best choice.
And if you're joining us late, we did say earlier that there is some research suggesting that in pregnant women, up to 20% concentrations of DEET are okay. So, if you're pregnant, I can completely understand that you wouldn't want to use DEET because it's a chemical and it just might make you nervous, but there is some research suggesting that it's fine, and particularly if you're in an area as some people in the U.S. might be later this year, or as people in Puerto Rico or Brazil are now, where your choice is use an effective repellent or potentially be exposed, you should use an effective repellent.
Absolutely.
So, yeah, go ahead, Dana.
Sure. We also have a few users chiming in wondering exactly how long does the Zika virus stay in your system?
So the exactly how long answer, I don't think anybody knows the answer, so that's the truth of the absolute. So what has been published and out there so far? For men, Zika virus has been seen up to, I think, 62 days after symptoms. So, that's a sort of 2-month window, and so the guideline and recommendation is to avoid sexual relations without a condom for 6 months, but again, to take the 2-month window for data we have about presence of the virus in semen, but then be more conservative, so go out to 6 months. The truth is we really don't, I think, when I say we, the whole community doesn't quite know the exact answer to that yet. For women, the guidance is about 8 weeks or 2 months to avoid pregnancy after an exposure or after a infection. And so I don't think there haven't been demonstrated cases of sort of sequestration of the virus that could come back later, as there have been with semen. So I say that's sort of where we are right now, which is we know a little bit, we want to give conservative guidelines, there's more to learn here.
Right. So it lives in the blood for, they think, maybe around 8 weeks, but in semen it could be as long
Longer.
as
Yeah.
they don't really know. So that's why there's that long.
Yeah, and I don't even think it lasts in the blood for that long.
Right, but that's the
maybe
sort
about
of
2 weeks
margin of safety.
Right, and then they want to
Exactly.
give us a margin of safety. That's right.
Exactly. Okay, another question.
Yeah, we do have another question. One user wants to know, and excuse me if my pronunciation is off, but what are the differences between Zika and Chikungunya?
Yeah, so we need to ask a virologist. So they're both RNA viruses,
So
to
we
my
have a
knowledge,
virologist.
right? And they're both what they
Feel
call
free to post.
flaviviruses. So they're actually pretty similar. They're like cousins. They're like first cousins. So on some of the tests, especially the immune tests, can pick up and they say, we know we have a flavivirus here, but we don't know which one. So there certainly is confusion. And when you have someone, like for instance, what we have seen in the Bronx a lot, women who might have grown up in Puerto Rico or grown up in Dominican Republic, and they had childhood immunity to dengue and chikungunya because those are endemic. So they have antibody to those because they grew up in countries where they were exposed as children. And now we're trying to discern, did they have a Zika virus infection? But there's cross-reactivity because of some of the antibodies.
So it kind of confuses the test.
Very much
Okay.
confuses the interpretation of the test.
Right.
So that's where you need now to go from general public health messages to a specific doctor, and sometimes a higher specialist or a geneticist or a virologist, all kidding aside, to start to tease that apart. And then you need more specialty testing to try to pull apart which exposure was it really. So I mean, it's really interesting, but definitely touch your doctor if you get to that point.
Right, and that's why they're going to take a really detailed family history. So I think we're going to wrap up for today. I want to thank Dr. Siobhan Dolan for her time, and the March of Dimes for connecting the two of us. If you have any more questions, I cannot recommend highly enough that cdc.gov/Zika site, and we will put on our page that link, as well as some links to articles on parents.com and some resources that the March of Dimes offers in both English and Spanish. And I hope you'll join us for the next Facebook Live next week. Thanks so much for being here.
This is the first thing we've done since we became Riley's parents.